fantastic DNP program at UW-Madison School of Nursing. It prepares individuals for specialty practice in areas that they really want to make a difference.
They give you the tools you need to just change the world.
We're taught how to question the system and how to keep moving practice forward, which ultimately is bettering healthcare for our patients.
Here at UW, we have amazing resources. Not only are you looking at being at the flagship of the UW system, you have access to the leaders of the field. This sets the UW nurse up for nothing but success.
I chose UW-Madison's DNP program in nursing because I knew it was well connected throughout the state, that I would get a broad diversity of experience, that if I were to go to another school, I would be less confident that I would be able to attain that diverse array of experiences and the depth of experiences. That instinct was totally right.
What great faculty I had and helped me through the program, because they're all practicing in their roles as advanced practice nurses, so they're really the experts of the areas they're teaching. So they have a wealth of knowledge and they ultimately want everyone to succeed. Our faculty also really work with us to tailor our experiences to what we're interested in.
For your preceptorships, that UW-Madison finds the preceptors. Some of these schools do not provide preceptors.
My program was personally hybrid, which I liked because it allowed me to be an adult. So you have a lot going on outside of school that allowed that flexibility for it.
I loved it when I had the classes. There's rooms where you can study with dry erase boards, and me and my friends would meet up and just work on our studies, hone our skills.
Our goal to prepare the students in our online tracks is to widen the scope of what is possible and beyond. We're working to make sure the students are up to date with what is happening now in their respective fields to allow for a seamless transition to where the students want to take it next. You leave this program being an advanced practice nurse. That's just the beginning. From there, many of our doctorally prepared nurse practitioners go on to participate in education, such as nursing education. They go into leadership, advocacy.
If you hear something in your facility that's not going well or it's status quo, I feel like being a Badger nurse has given me the guts to just help make practice change and not just accept this is the way we always do things.